Welcome everyone. This is Kenneth Gehrig with Partners, and Partners has a primary focus of improving lives and strengthening communities. One of the ways we're doing this is through sessions like these. And today we're going to be talking about veteran suicide prevention, and we are honored to have Crystal Miller with us. She's the Field Operations Manager for the North Carolina Department of Military and Veteran Affairs. And so Crystal, so excited that you're here, going to share some information with us. Thank you. Please just introduce yourself, tell us a little bit about what you do, and you can continue.
Okay, thank you so much. I am Crystal Miller. I am a veteran of the Iraq OIF War, so I was in Iraq in 2005, 2006. I worked for the school system here in Wilkes County during that time, and in 2012, I decided that I wanted to start helping veterans. So I joined the North Carolina Division of Veterans Affairs at that time. That's what we were called. We were not our own department yet, as a veteran service officer. I became a training officer, a regional manager, and now a field operations manager. As the field operations manager, I've also taken on the role of the facilitator for our North Carolina Governor's Working Group, which is a collaborative to help people connect to resources. And also I'm the team lead for the Governor's Challenge to prevent suicide among service members, veterans, and their families. So I wasn't really sure where to start, but I think I'll start with the Department of Military and Veterans Affairs, since that is my home base. One thing I want to tell you first off is we have a website, milvets.nc.gov, and that's milvets.nc.gov. And on that page, under services and benefits and claims, you can find the phone number for a service officer in any county in North Carolina. Some of those counties we cover as an agency, but most counties have their own veteran service officer. So we assist veterans and their families and dependents in obtaining or maintaining privileges, rights, and benefits to which they are entitled under federal, state, or local laws. And as such, we have veteran service centers set up across the entire state. We have 12 physical locations in one of 4 regions. We also have 2 service centers set up in the Salisbury VA Medical Center and the Durham VA Medical Center. Those on-site folks help veterans who have maybe just been diagnosed with a disability that could be connected to their military service. All of our service centers are manned by at least 1 veteran service officer and a veteran service technician and support staff. And each of those centers are broken down to have a team of counties. So each center has anywhere from 7 to 13 counties that they work together with, we collaborate with, and most of our work there is related to the Veterans Administration benefits and VA healthcare. So we help veterans to apply for those benefits, to get enrolled in VA healthcare if they can. And then also we have an appeals team that works in the state service office, the Winston-Salem VA regional office, alongside the federal VA. And so anyone who is represented by the North Carolina Department of Military and Veterans Affairs has their own team to help them in any appeals processes for benefits that they may have been denied. And so we're really proud of them. We also have veteran service officers in the Lumbee Indian tribe and in the Cherokee, Eastern Band of Cherokee tribe. So we support all of our counties. We provide their accreditation and training, their continuing education so that they maintain their accreditation. And of course, so they stay up to date with the latest laws. A lot of veterans laws change quickly sometimes. Sometimes they change and it's months before we know that it's changed. So we have to really work hard to make sure we're up to date on the newest laws for our veterans. So we make sure we can maximize their ability to get the benefits that they deserve and their families. So as the Department of Military and Veterans Affairs, and you slow me down and ask questions anytime you want. We have the responsibility to host and guide the North Carolina Governor's Working Group. And in 2006, an intra-governmental working group was established focusing on health and wellness, job creation, workforce enrichment, legal and final services, and benefits for veterans. And over the years, this coalition has developed into a referral and collaboration network that gets veterans and their families the services and supports they need and reduces red tape. Governor Cooper is supportive of the initiatives undertaken by the working group, and our vision is that we want government to work for our veterans. Like, our veterans shouldn't have to work so hard to get the benefits that they've earned. And I should say that I do refer to veterans a lot. We are referring to service members, veterans, their families, their dependent children. Some of our veterans have dependent parents, so we do serve a wide variety. It's not just veterans, but I do catch myself leaving the remainder of that group out. We serve a wide variety of people. So the Governor's Working Group meets once a month on the fourth Thursday of the month, and that meeting, and you can get to that website at ncgwg.org. And that meeting is to bring together resources that are available that veterans and their families may not know exist. We broadcast on Facebook Live. This year, since we have gone virtual, we've actually increased our viewings. We've almost doubled them. So the this virtual live has really helped us to get the word out even more. It's kind of a reverse blessing, I guess, that at least people see us and see what we have to offer there. So one of our partners that I want to mention before I go into the Governor's Challenge is the NC Serves networks. Those NC Serves networks help take all of the people that are on our listserv for the Governor's Working Group, all of those people that have signed up and said, we have benefits. It could be nonprofits, it could be for-profit, it could be all kinds of things for veterans. And so those, I'm sorry, distraction. Hey, please wait, okay? And so the Governor's Working Group, all of those people that are in that network are connected by our NC Serves networks. And so the NC Serves networks are located in Western North Carolina in Asheville. We have one in Charlotte, we have one in Raleigh, and we have one in Jacksonville, which is our coastal network. We work very closely with them. We also work with our healthcare partners, our mental health care partners are enrolled there. So for example, if a veteran came into one of my veteran service offices and that veteran did not qualify for VA benefits, but that veteran was looking at being homeless and that veteran needed a job, we would put that referral in for the NC Serves network and get that veteran the help that they need. Just because they didn't qualify for VA benefits, the thing that we have to offer doesn't mean that they are not eligible for some other benefits. So I just want to make sure and mention them because they are integral to our connecting veterans to the resources that they need. And then I'll go into now the Governor's Challenge. So in November of 2019, we received a letter from SAMHSA, that is the Substance Abuse Mental Health Services Administration, and their Family Technical Assistance Center. So it's a big acronym there. We received a letter asking if we would participate in the Governor's Challenge. And I'm looking at our Governor's Working Group and what we've been trying to accomplish, which is suicide prevention, reduce homelessness, reduce unemployment for our veterans. And I'm like, well, of course we'll accept the challenge. Why would we not? We already have the base built for this. So in North Carolina, our 3 priority areas are based on the Veterans Administration National Strategy to Prevent Suicide. And right now we are hyper focused on identifying veterans, because we know for a fact that less than 50% of the veterans in North Carolina are enrolled in VA healthcare. We know that less than 50% of the veterans in North Carolina are receiving any benefits from the VA, never been touched by the VA. And so we're looking at least like 300,000 veterans who have not been touched by the VA. So our number one priority to identify service members, veterans, and their families is going to be supported by the Ask the Question campaign. We will take these tools. We've developed a toolkit that will be available on the Challenge website, and you can get there through the Governor's Working Group website. That toolkit will be available to help train providers on how to ask the question, have you or anyone that you loved ever served in the military? And when the answer is yes, yay, we've identified another service member, veteran, or their family. And from there, the toolkit will guide providers. And when I say providers, we are targeting non-VA healthcare providers, mental health care providers, and then, of course, we're targeting anyone who might have resources for veterans. We even go so far as if someone walked into the animal shelter to surrender their dog, we want those staff to say, have you or someone you loved ever served in the military? And then when the answer is yes, our next part of that first priority is to assess for suicide risk. Because we also know that of those veterans who have completed suicide, a huge number, and I don't have my percentages down, I'm sorry, but a huge number of them have been seen by a primary care provider, a non-VA primary care provider, within a month before they completed suicide. And if we had identified them, if we had asked the question and then did the assessment, and we're using the Columbia Scale for Communities, which is a really simple suicide risk assessment that anyone can use. We provide training for that on our Psych Armor website. Also make sure to get that link to you because we have a unique URL for North Carolina. We did a deal with Psych Armor. So we're going to also train them not only to ask the question, but we're going to train them what to do with the information once they get it. They ask the question, they're positive for veteran status, they do an assessment and they're positive for suicidal ideation or something set off a red flag. Then our next priority is to improve connectedness and care transitions. So we have a lot of veterans who left an emergency room in with a suicidal ideation, or they came into the emergency room because they were thinking of suicide, that left without follow-up and then went on to complete suicide. So improving connectedness, making sure that and this comes back to our NC Serves relationship. If my VSOs do this assessment and they have a positive assessment for suicide risk, we need to know who to get them to. Who can we connect them to right now? And then the transitions. So we used to run off of a Rolodex and give a phone number to our veterans and say, here you go, call this person and they'll help you. We can't help you here, but call them and they'll help you. And we have to get away from that. Warm handoff is used a lot. We want it to be a real steamy hot handoff. We want to make sure that these people are talking and connected before they leave my office, before they leave your office. They know what they're going to do next. We know that financial stability is one of the #1 causes for suicide or financial instability. So with the NC Serves networks, we're working to get people in school, get people trained, get people employed, get people in housing, stabilize them, right? So that they're not in a place that they don't have any hope anymore. Our last priority with the suicide prevention program is the lethal means safety. Because we know if we can put some time in between the thought and the action of suicide, that we will be able to prevent suicides. It's proven. These are scientifically proven facts that if we can put enough time and space in between the thought and the plan and the action, that we can prevent suicide. So the last step on our journey is going to be to educate the public, to be able to educate each other and remind each other that it's okay to lock your guns up. It's okay to put a gun lock on them. We are also partnering with Together with Veterans, which is a rural suicide prevention program coming out of the VA Rocky Mountain Myrick in Colorado. So that is Visit 19, Rocky Mountain Myrick They developed a rural program, and North Carolina was lucky enough to get 2 of those. Thank God I made really good friends with them. So they're piloting those 2 programs here, one in Carteret County and one in Macon County. So we have one on the east and one in the west. These are programs run by veterans for veterans, and they follow the same concepts, except they make adjustments and adaptations for rural North Carolina, because getting the word out in Durham, North Carolina is much different than getting the word out in Macon, North Carolina. So we have to handle the practices a little differently. Rural North Carolina veterans have less trust for the system. And so that's why we let them build their own system, and we help guide them, and we give them the tools that they need to expand this program. The community assessments that we have done on a score from 1 to 9 in readiness or understanding of suicide and suicide prevention was very low. It was a 2. And that's going out and just asking regular community members, are you aware of any suicide prevention programs in your county? No. Do you know what you would do if you had a relative or someone who was talking about suicide? No. Do you know the red flags? So we have to teach our communities how to deal with this. And not only is that going to affect veterans, it's going to affect our entire communities. So we're really excited about the challenge. We're coming up on a year. We just did our evaluation conference, and thank God I have smart people on my team from RTI who all they do is collect data and help us to understand if what we're doing is working. So it's all connected. The Department of Military and Veterans Affairs, the Governor's Working Group, that's our platform to get our word out. Also on that Governor's Working Group page is Operation Home and the information for Operation Home, NC Strive, which is education for our student veterans and helping them to understand how to best utilize their education benefits. Because again, we're just looking to stabilize our veterans. We've also just opened the Life Center in Butner, North Carolina, which has 100 beds. And that is for, especially in the behavioral health realm, those people who are addicted, who have mental health issues that need to be addressed on an inpatient basis. They can live in that home for up to 2 years. They have not started taking patients yet. They're still trying to figure out the logistics with COVID. But please do look up the Veterans Life Center in North Carolina. That is going to be a program that's going to save lives. With those 100 beds, and honestly, our goal, because we're looking at about 250 veteran deaths in North Carolina at our last count, our data is always old. We're looking to get 250 people stabilized so that they do not take that last final step. Anything else you can think of that I could add? I feel like I left some stuff out. I'm sure that I did.
There's a lot of great information, Crystal. A lot of great information. I think from here, how can people connect with you? If there's any piece of that they want to dig deeper into, can you let them know how to reach you?
Yes. So the best way to reach me, since I'm teleworking, is by my email address, and that is crystal.miller@milvets.nc.gov. That's CRYSTAL.Miller, MILLER @milvets.nc.gov. Best place to reach me.
Awesome. Well, I hope lots of people will do that, Crystal. And I think we'll go ahead and we'll stop there. Again, that was a lot of information. It was great. And I hope everyone will reach out to you. Thank you so much for your time today.
Thank you so much. I really, really appreciate it.
Absolutely.